Good morning, everyone. Today's session is going to be really helpful and is led by Dr. Namrata from Apollo Cradle and Children's Hospital. She is going to talk about cervical cancer awareness. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hi, I'm Dr. Namrata. I'm associated with Apollo Cradle Children's Hospital, the HSR layout branch. And today I have been asked to talk about cervical cancer. Now, cervical cancer is one of the most common causes of death in women. And in India, one person dies because of cervical cancer every 5 to 10 minutes. In the earlier days, the Anganwadi workers were taught to do a screening, but it has not been very beneficial because women felt quite shy. Thankfully, there is a vaccine now. I will be talking about more of that in detail. We all know that HPV virus is known to cause 99.9% of all cervical cancers, and not all HPV viruses are cancer causing, but they are divided into groups. So there are the four most common and then the nine most common which cause cervical cancer. And it takes a long period of time for a woman to become cancerous. So maybe she was sexually active or she had an HPV virus in her 20s, which was neglected in her 20s and 30s and 40s. And then that becomes precancerous by the time she's 40, 45, and turns into a cancer in the later stage. So, most common causes for women in their 60s telling that they have cancer is a foul smelling vaginal discharge. There is bladder issues, rectal issues. They feel everything is stuck inside. There is severe itching associated. There can be bleeding after menopause, which is always an alarming sign. So, these are the most common symptoms that the woman will say that she may be having a cancer. Usually, in these things, we do a vaginal examination to see an internal examination is done. Associated tests like a scan can be done. We do an MRI and then later a PET, and then that is how we go ahead. What I feel is instead of talking about cervical cancer, I should talk more about the prevention because the whole point of having a live um, talk streaming would be that how we can prevent it. Now, what you need to know that 80% of unvaccinated women will have some form of HPV virus already. So, how can we prevent the cervical cancer from occurring in the first place? One is when you do have sex, use a condom because sexually transmitted disease is a precancerous. It's one of the things which can cause cancer. Condoms help a lot. The second is a routine pap smear. Like I said, pap smear is not the greatest way of finding out. There's a liquid based cytology which is very, very effective nowadays. But the third and the most important is vaccination. Now we do have a vaccine available which can be given from 9 years of age up to 45 years of age. And I think all of us should go ahead and get these doses routinely. And so, what we need to know is how you would get this. It's not that only a woman who has, sexually transmitted diseases get cervical cancer. It can occur with cuts, with aberration, with tears, with skin to skin contact. Obviously, repeated pelvic inflammatory diseases can cause cervical cancer, but what you need to know that there is no treatment for an HPV virus. So even if we detect it, we repeat the test after 6 months to see how it is, and we will go on monitoring such patients. What can be the associated other things that can tell me that this woman has an HPV related disease? There can be genital warts somewhere on the body, which can also tell me, that there can be a chance of having cervical cancer. What you need to know is that HPV virus doesn't cause only cervical cancer. It can cause as small as a wart, which can be troublesome or you can ignore it. Some of them fall off on its own. It can cause cervical cancer, what we're talking about. It can cause vaginal, vulval cancer, mouth, throat, head and neck cancers. And in men, it can cause oropharyngeal, penile, anal, rectal cancers. So it's not HPV doesn't cause only infections in women. It can cause diseases in men as well. So routinely, the CDC, the FDA, and now the Indian government also says that all women who are above the children who are above the age of 9 to 11 years must get vaccinated, whether you are a male or a female, it doesn't matter. The government says 9 to 26 years, but we do give vaccines according to our guidelines up to 45 years of age because the efficacy is good. So if you get vaccinated, your chances of prevention would be as high as 95 to 98% depending on your risk factors. Obviously, if you've taken it at 9 or 11 years of age, HPV related cervical cancer is prevented in 99% of the women. There are some questions which I would just like to go ahead and answer on my own before even somebody raises a doubt. Is if you're a married woman, should you be taking the vaccine or not? Yes, you should be taking a vaccine even if you have one single partner. If your first partner was your husband, it is a routine thing that you need to do, because that data suggests that women are at increased risk of getting cervical cancer up to 30% with 1 year of unprotected or protected intercourse, and this percentage will rise up to 50% in women in the next 3 years. So whether you're married or you're not married, you have a single partner or multiple partners, everyone should just go ahead and take the vaccine. And then, how many times should you take the vaccine? So, usually the dosage is around 0, 2, and 6. When I say 0, 2, and 6, 0 is the day you get the vaccine, 1 to 2 months is from the first dose, and 6 months from the first dose. But what you need to know is that everything can be finished within 1 year. So, if instead of, say, second month, you missed your second month dose, you come on the third and fourth month, it's not like we need to restart it again. We can go ahead and complete all the doses in this fashion in complete 12 months. And once you've taken the vaccine, these are usually lifelong. Studies have been done up to 12 years. But what you need to know is that even after that, the chances of you getting HPV related infections and cervical cancer was significantly reduced. Men also need to take the vaccine because 90% of anal cancers are HPV related, 60% of oropharyngeal cancers, and the second most common cause of death in men because of after smoking for oropharyngeal is an HPV, and 50% of penile cancers are because of an HPV. There is no screening for HPV in men as well, and women who are not sexually active need not be screened routinely before 30 years. But after 30 years, it makes sense that we screen everyone. And no, there is no screening for men and women, men and children at this point of time. What are the two types of vaccines that are available? There's a 4-valent vaccine and a 9-valent vaccine. What I mean by valent is the most toxic. So the four most deadliest is in the 4-valent, and the nine most deadliest is in the 9-valent. 4-valent is usually for the warts and the cervical cancer. 9-valent is for all the penile, the rectal, the vulval, the vaginal, all of those cancers. Irrespective of whichever valent vaccine you take, you can, you know, the doses remains the same. The dose remains the same. It does not change. So that I don't want to keep it too busy because I would just be talking. I've just told you briefly about what I feel the prevention should be for cervical cancer. I think 2024 year should mark the age when we've decided that, we will all get immunized so that we are protecting ourselves and our loved ones. Thank you. If anybody has any doubts, I think you can just um type it and send it across.